My name is Sanjay Chaya. I am an anesthesiologist in Ottawa, and I have a pretty broad practice. I work in the operating room in a traditional anesthesia role. I have a chronic pain clinic. I am the medical director of a chronic vent unit for long stay ventilated patients that can't live elsewhere. And I have an addictions practice. So the way that this all came to be for my experience of being through the process really helped me want to be on on an advisory board to help expand the reach of this team, this group, and what they're doing. So the idea of actually collecting the fees for the services that are provided in a fee for service setting that you run in correctly on time, that's excellent. That's very helpful for all physicians in the practices they do. The hard parts of that process in terms of chasing the reconciliation, ensuring that errors are corrected, which is all part of getting the full compensation for the work that you've done, and the commitment the PFF has to that really resonated. And then finally, the sort of social governance piece that they've decided to undertake completely separate of the business, but in helping the healthcare landscape to bring physicians in to a healthcare practice setting in Canada and Ontario specifically, where there's a shortage. This is not something that they had to do, but it's something that really helps you connect with them at a level where it's clear that they understand some of the travails of physicians and that they have a clear idea on how to make some significant improvements in the lives of physicians. So simply, let's get you paid what you're entitled to get paid. If there's a problem with your pay, let's fix it. And we know there's a shortage of physicians. Let's get some more in. Hard to argue with any of that. So I think that in a global healthcare landscape, Ontario, Canada has some unique idiosyncrasies as to how you practice, how you get licensed, what's the regulatory framework, and then how do you get paid? What are the opportunities for people to work in? I mean, just in general, getting a license in Ontario from an external jurisdiction is a daunting proposition. Never mind where are you going to practice, what's that setup going to look like, what type of medicine you're getting. You don't have the networks when you're coming into a setting that's completely foreign. So those sorts of connections and mentorships help give you a much better setup for success. Part of the large difference of the healthcare landscape in Ontario is the bulk of it is fee for service, which means you really have no idea what you're going to earn till you start working, submitting your bills, understanding what's coming in, and then doing the extrapolation of the math to know what it is you're going to earn. Most traditional jobs have a salary, right? I'm going to put in 37.5 hours or whatever the contract is, and I'm going to get paid this. In a fee for service setting, that's not quite clear. If you're in a proper network and you have many people that have gone before you, you can say, hey, you've been doing this for 5 years. What do you make? What does it look like? What are the hours like? And you can get some feedback. If you're coming from outside and you don't have that network, then you really are in the dark. The dashboard brings you data, hard data. Here is what this clinic has been generating in terms of money. Here is what this type of work looks like. And here is the data for 3 months, 6 months, 8 months. So now you have some solid, objective information that allows you to make these kinds of decisions. Because if you're uprooting whatever you might be doing in upstate New York to move to rural Ontario, for example, you have no idea how that translates in terms of your lifestyle, income, support for your family. It's a much harder decision than if the dashboard can give you some of that clarity. The whole thing, just really once you understand it, almost begs the question why everybody wouldn't let PFF look at their data and see what it is they can do. Because if you say to every group, I can recover you 15%, 20%, and it's going to cost you 4. Well, your net 11 to 16% increase in your business, you're getting paid correctly and they're doing all the work. So there's a financial return and a time return and a peace of mind return. In that setting where you're being offered an opportunity to make more money for less mechanical work of the billing submissions. I want to be clear, not clinical work, and automate that process. And you can try it for free for 6 months. I don't even know how anybody could say I'm not interested.